My name is Emily Kile. I am an attorney here in the Scottsdale area, and I practice in the areas of elder law, special needs planning, estate planning, guardianships and conservatorships, and probate and trust administration. And I've been trying to have these webinars at least once a month and often twice a month, and to try and allow people to get the education that you otherwise would be getting live, and now we have it virtual. The positive of virtual is that it's recorded all the time, so we can rewatch it and share it with friends and family who may not have been able to attend, and also that you can watch it again in case there are things that were important to you that maybe you need a little refresher on. I am certainly not here to endorse any product or company, but I have had the pleasure of working with Bob and his team at Cypress, and thought it would be really important to get some information about how in-home care works. I think there are lots of misunderstandings about companies versus hiring your neighbor to come over and provide services, what services they can and can't provide, and how those services can even be provided within somebody who is not at home any longer. So I thought this would be a great opportunity to have that conversation. I thank all of you for deciding to attend. I know there's lots of virtual stuff to watch these days, so I really appreciate that you've decided to join us today. As I said at the beginning, there's a chat box and a Q&A, and it doesn't make any difference to me which of those you decide to use. If you have a question or a comment or a concern, just put it in there, and I will do my best to interrupt whoever's chatting to get those questions and concerns answered for you. So again, I'm thrilled we have Bob Roth here today, the managing partner of Cypress Home Care Solutions. He assisted in creating Cypress with his family in 1994, and with nearly 35 years of consumer products, healthcare, and technology experience, he successfully brought the depth and breadth of his experience to the home care trade. Again, I've had the pleasure of working with him for clients that we have in common. So I'm just so happy to have him back. He also has a radio show and was kind enough to have me on as a speaker, which is kind of the same as being virtual. You're chatting to the space and hoping somebody's listening to you, but it was a lot of fun. I think we had a really fun conversation. And he, of course, has those up on his website, as do we. So if you want to listen to that, by all means, check it out and you can hear us chatting. And then we also have Michelle Cornelius, who's here today. She has a Master's of Social Work from Arizona State University and a Master's of Education in Human Resource Development. And most of her work experience has been with people diagnosed with dementia, either in their homes or in memory care facilities. And she is currently the director of the memory care program at Cypress Home Care Solutions in Phoenix, and a program specialist for Honor Care Network out of San Francisco, California. So I hope you'll enjoy the conversation today. Again, please feel free to ask questions in the chat box or the Q&A. And with that, I will let them take over. And again, thank you all so much for attending. So we look forward to your presentation. Thank you.
Good afternoon, Emily. Thank you for the opportunity to present during this webinar here. I want this to be very educational, but I also want it to be interactive. Emily will be taking questions, so if you have any questions as I move through some of these slides, please feel free to ask them, and I want to be able to address your questions right there on the spot. We will leave some time at the end to be able to answer questions as well, but I'm really, really happy to be here today, and thank you for this opportunity to spend, let's call it your lunch hour together. So the title of our engagement here today is In-Home Care for Your Loved Ones, making sure that they are safe, active, and loved. So I would be remiss if I didn't really recognize the fact that November is National Family Caregiving Awareness Month. We have over 50 million family members that are providing care for loved ones. And they are really making the ultimate sacrifice to really give up their lives for loved ones. And I have always felt that November was a great time to recognize these unsung heroes. And it's a great opportunity for us to raise awareness for these family caregivers and some of the challenges that they are having. We also take this opportunity to celebrate the work that they do. And, you know, we want to also take the opportunity to educate family caregivers to self-identify who they are, because so many of them don't realize it. I mean, just the mere fact that you may be helping a family member just going to get groceries or prescriptions from the pharmacy. I mean, you are a family caregiver. So, you know, I salute you and those that are out there making those choices and really, you know, doing those selfless deeds, if you would. I also want to remind you that if you know of somebody that is doing that, to be there to assist them, to be there to be a listening ear, and also to recognize the fact that, you know, they are doing some of the really hard work. You know, I always say that don't ask to help, because most of the time they won't accept your help. Just do. You know, if you're making a casserole for dinner, make two and then drop one off to that person that is making that sacrifice. You know, the Thanksgiving dinner table this year, you know, take inventory of those family members that are around, and you'll be able to self-identify and really know those that are actually helping family members. And again, I often forget the fact that we're in the middle of a pandemic, and maybe you don't have that opportunity to be around each other at the family table, but you might be holding virtual events. But I do want to just take this moment and recognize those unsung heroes that are making the ultimate sacrifice to help their loved ones through this journey that we call life. So today's conversation, I want to talk about the obstacles to aging in place. And then I want to really talk about the 3 A's. I want to talk about awareness, affordability, and I also want to talk about advocacy. So that's really where I want to focus our time and our energy here today. So I want to talk about some of the obstacles that we have for aging in place. And Michelle's on the presentation with me, and Michelle, always feel free to jump in and expand on anything I am talking about. But
you know, I have no trouble interrupting you, Bob. You're doing great.
well, thank you very much. You know, first and foremost, you know, activities of daily living. And I have these 3 boxes here. You know, capable of going out independently, capable of walking without help, capable of sitting, capable of walking independently, capable of standing, mostly laying down, capable, you know, of getting dressed, capable of bathing, you know, meal preparation. These are activities that each of us do every day, and some of us are feeling challenged, and mainly I'm referring to our loved ones, and older adults are challenged with activities of daily living. Another obstacle of aging in place is chronic medical conditions. You know, believe it or not, you know, about 70% of our population, 65 and older, has 2 comorbidities. You know, they're dealing with either diabetes or CHF or COPD, arthritis. There's so many different illnesses and issues out there. So chronic medical conditions are definitely an obstacle for aging in place. And this is an area, this next one, that Michelle is somewhat of an expert in, and that is cognitive deterioration. You know, we have loved ones that are suffering from small cognitive deficits, all the way to being in the throes of Alzheimer's. And those are challenges for people to be able to successfully age in place.
Right. And you know, we're seeing real quick too with what we're going through right now with the COVID, what we're seeing is that people are deteriorating potentially at a faster rate because of the isolation that they're experiencing at home right now. Because anxiety and depression can be linked with cognitive deterioration, and we're seeing higher rates of anxiety and depression because of the isolation. And so, and because they aren't around people regularly, we're not seeing those symptoms as soon as we would in a time of a non-pandemic. So I'm talking to your family members, checking in if you're noticing cognitive decline. It might be worse than we're expecting right now.
You know, and I'm glad you brought up the pandemic, because I want to take a step back to the chronic medical conditions. You know, there really is a second pandemic that's going on right now, and people aren't talking about it. And that is, we have so many people out there that are suffering from some chronic illnesses that are not getting in to see their doctors. You know, they're scared to death to go out of their home and see their doctors. And their conditions that they're dealing with, whether it be COPD, CHF, diabetes, these are necessary chronic conditions that you need to be able to see your physician on and get regular checkups on. So, I mean, we need to be mindful of that. We need to make sure that our loved ones and ourselves are going to the doctors. You would be surprised if you are one of those people that are not seeing the doctor, or you know someone that isn't seeing the doctor. Many of them are doing telemedicine. The Centers for Medicare and Medicaid Services have relaxed the rules as it relates to doing telemedicine. They're allowing doctors to use, you know, non-HIPAA compliant devices where they weren't before. So your doctor can FaceTime, your doctor can Skype, your doctor can Zoom or Google Meet with you to really, you know, visit with you to see how things are going. And if it is imperative that they physically visit with you, trust me, they are taking all the precautions to make sure that the environment is safe for you or for your loved one. And, you know, I will tell you, the second pandemic is that people aren't getting in to see their doctors. And next thing you know, their COPD condition has gotten really worse. And next thing they are is they're in the emergency room, and that's where they didn't want to be in the first place. So we need to be mindful that loved ones have chronic conditions. You may be experiencing chronic conditions, but get in to see your doctor. And then the last obstacle to aging in place is informal caregiving. And that is purely what I talked about before. There are a lot of people that don't self-identify as being that caregiver. And that is certainly a challenge. And certainly we want to make sure that they get the education and the resources that are available. And our company is one of those resources, but there are a lot of other entities that are out there, like the Area Agency on Aging is one, Duet, Partners in Health and Aging is another. So there are a lot of great social service organizations out there. The Foothills Caring Corps that Emily knows so well, that's another resource. So there's so many resources out there that can help you in this journey that we're all dealing with called life. Other obstacles that are caregiver shortage, and we're going to talk about those here. There's also the cost of care. That's a huge obstacle for aging in place. And then, you know, what Michelle and I talked about was COVID and infectious diseases. And, you know, I'm here to tell you that it isn't going away tomorrow. And if you had dreams that it would be, I dream about that too, and it's not. We're definitely poised to deal with COVID in 2021 and possibly on. But I will tell you, agencies like ours and other home care agencies and other healthcare institutions are going to be better prepared for these type of infectious diseases because of our experience with COVID. We have limited care delivery services. You know, we're getting better at that as a result of this, but there are some limitations in getting care delivered into the home. And then the number of people living home alone is soaring, and I will share that with you. You know, it's ungodly, and I never realized the numbers were what they were until a couple of years ago when I started digging in. Let's talk about the caregivers. This is a chart that was created by the AARP. AARP does a study. They try to do one every couple years. This one is from a couple years ago. And basically this chart is derived from census data. So it's census data, and if you look in the top right, you can see that it's persons 45 to 64 that are most likely to provide care for persons that are 80 and above. So it's not paid caregivers, it's all type of care. So if you take a bucket of all those folks that are 45 to 64, caring for those that are 80 plus, and you pull that together and you get the ratios that you see below. So the United States support ratio for those that are 80 and above in 1990, it was 6.6 people that were 45 to 64 that were available to care for someone that was 80 and above. In 2010, that went to 7.2. And you can see just below it, Arizona, and below that, you can see Florida. So I use Florida because we know that's an aging community that is not too different or too dissimilar to what Arizona is going through. So as you can see, we were at 7.2. Arizona was at 7.0 in 2010, and Florida was at 5.5. In 2030, the United States is at 4.1, and they're anticipating Arizona to be at 2.6, Florida at 2.9. And this is the scary part. By 2050, we're going to have 2.9, almost 3 potential caregivers for every person that's 80 and above, and Arizona's going to be less than 2. Florida, just a little bit more than 2. So this is a real challenge that we need to be talking about. We have a situation where the needs are outstripping the supply, and that's something that a lot of us are cognizant about, and we also need to be addressing. Part of that is the global birth dearth that we're dealing with. The global birth rates are down quite substantially. It shouldn't surprise anybody. You know, as you can see, World War II, after World War II, we had the baby boom, but it has gone down precipitously, really from 2010 on, so 95 on. So you can see that we just don't have enough people to be able to care for those that need care. And they're predicting 2047 being a really big number where we're really going to see births really drop off. We also, and part of the reason for that is the families are being delayed. And for many of you that are on this call here today, you probably see it within your own families, where, you know, today 1 in 5 American women are child-free compared to 1 in 10 in the 1970s. So, you know, a lot of couples are coming together. They're choosing to either not have children, or they're choosing to start to have children later in life. And that is a direct correlation with the numbers that I shared with you. You know, this is a staggering stat. I don't share it, proudly, but I will tell you that our country was built on nuclear families. I'm from Baltimore, Maryland, and you know, I lived in an area that, you know, could be construed as a ghetto, so to speak, because cousins and nieces and nephews and uncles and aunts, we all lived together. We lived really close to one another. My grandmother, she cared for not only her mother, she cared for her husband, she cared for her brother, because that's what we did. Today, because of the advent of technology, we are looking at about 280 miles that separate us from our adult children. So, you know, we don't really have that nuclear family anymore. So we are requiring, or we need people to step in and help those people out, because family members aren't there, at least certainly the children aren't. So we have a lot of people aging solo. That's the number that really scares me more than anything else. In the US, and this slide comes from the MIT Age Lab. This slide's a little bit dated. This is from 2018. The number is close to a third now, but 27% as of then. And as you can see, in China, it's 15%, Europe and Japan are at 31%. So that means that 65 years and older, 1/3 of our population is living home alone. And you can see that what it looks like across the country. You know, Washington, D.C., it's almost at 50%. Atlanta's at 45%, Denver's at 40%. You know, we know that living alone is the equivalent to smoking 15 cigarettes a day. Michelle brought it up before. I mean, you know, just because of the pandemic, you know, it has caused a lot of depression and anxieties. But even prior to the pandemic, we were having these issues. So it is a staggering fact. The guy who runs the MIT Age Lab, his name is Dr. Joseph Coughlin. I will recommend a book. This is a shameless plug. It's called The Longevity Economy that he wrote. If you do get a chance, you can order that from Amazon. It is a really interesting book. He talks a lot about this. He's anticipating in about the next 15 years, this number to be closer to what Washington, D.C. is across the country. It's going to be about 50% of our population, 65 and older, is aging alone. So with such uncertainty in the communal living setting during this pandemic, what options do people have to consider? And, you know, I'm not here to take a knock at any of the communal living communities. Some of them are our best friends and we work closely with them. But, you know, the mere fact, and this stat comes from AARP as well as from the Department of Health Services, 2/3 of our population here in Maricopa County that has passed because of COVID died in these communities. It's a real challenge. So aging in place, right in the comfort of your own home. Why not? Home care is the solution that most families should be considering. 92% of aging adults 65 and older want to age in place. So how do we do this? Home care is, and home care has an awareness issue. And for many of you, you guys know this face here, Rodney Dangerfield. Let me tell you, I get no respect, right? He was perfect at it and always pulling at his tie. And I try to tell the young kids today about Rodney Dangerfield. They don't have a clue who am I talking about, but home care has been that way. Home care has an identity issue. The biggest challenge we have as professionals in the healthcare industry, really doctors, nurses, social workers, case managers, they still think that in-home care and home health are the same, and they couldn't be different. So let me take you through a chart. This really talks about the difference between home care and home health care. On the left-hand side is home care, on the right side is home health care. So the goal in home care is to assist and empower an individual and their families to meeting their identified needs. In home health is to treat an illness or injury that will aid an individual in regaining their strength and independence. So the biggest difference is in home care, it's hourly visits. So if somebody was to engage a home care agency, they're engaging that agency on certain days, on certain hours. So let's say it's just, you know, during the awake hours. So it's Monday through Friday, 8 to 5. That's when they're looking for a home care giver or home care aide to be there to assist them. So our goal as agencies, we want to make sure we have that caregiver there. I tell our team that if you are 10 minutes, I want to make sure I get it right. It's a Vince Lombardi. It's a Vince Lombardi quote. If you're not there 10 minutes early, you're 20 minutes late. So, you know, look, we have clients that pay a lot of money for our services. So we want to make sure that we're there on time and we're ready to provide the care that we're expected to deliver. On the home health side, it's episodic visits. And for those of you in the audience that have received home health, it's kind of like getting your cable company to come to assist you with your cable or telephone. You know, they give you a range, or a plumber, or air conditioning guy. They'll tell you we'll be there 1 to 3, because home health has nurses and therapists that are going in to see other patients before they come to see you. In home care, it is an hourly visit. In home care, we partner with home health and hospice. Home health does partner with us as well. On hospice, they can't really necessarily partner with them because they share in the same payer source, especially for those seniors out there. They're sharing in Medicare dollars. So they can't have home health and hospice at the same time because they can't really share in those fees or in those dollars. In home care, there's no homebound requirement. In home health, there is. In home care, there's no medical eligibility. In home health, there is. You need a physician order on home health. You don't need one on the home care side. And the length of stay is determined by the client or family on home care. Length of stay on home health is based on the diagnosis and the need. And then lastly, home care is paid for privately or through LTCI, which is long-term care insurance, or All-Tex. In our state, All-Tex is Medicaid. And lastly, there's veterans, and I'll get into that in a second. And the services are activities of daily living assistance, meal preparation, transportation, errands, light housekeeping, medication reminders. On the home health side, it's paid by Medicare and private insurance, and the services are skilled nursing, physical therapy, wound care, and speech therapy. So I share these with you because it really challenges us that the professionals in the healthcare industry, physicians, social workers, and case managers and nurses still think they're one and the same when they say, oh, we've already recommended home health. Well, it's an episodic visit. That person that I just shared with you may be home alone. So there's nobody to receive them. So when they get home, an episodic visit isn't going to help them get dressed in the morning or bathe or make sure they have their meals or take their medications in the right doses at the right times. That's where home care comes into play. So, exposing the truth. Not all home care models are the same. And this is something that we really need to make certain that people in our community really realize that. So the two options on home care is a home care agency, an employer-based agency like Cypress and so many others here in our community, or independent contractors. So yeah, I take you through this chart because bonded and insured, home care is bonded, insured with liability and workers' comp insurance. And I can't emphasize enough workers' comp insurance covering accidents in the home. In independent contractors, there is none. Patients must cover all liability. And there is the belief that people feel like that their homeowners insurance with their umbrella liability policy will cover things. I'm here to tell you they're not. Who knows of an insurance company that just pays claims? They don't. They send out an adjuster. And when they find out that that care worker who was helping that family member in the bathroom, and there just happens to be that skin, soap, and water is a recipe for disasters in the bathroom. I mean, people slip and fall. And a lot of times it's not just the client, it's the caregiver. And having done this for 26 years, we've had a lot of caregivers get injured. And guess what? You know, home care agencies, employer-based agencies have the insurance. So a lot of people make the mistake. They say, oh, you know what? I can hire a private caregiver, an independent contractor. My homeowner's insurance has got it covered in case they get hurt. Not so fast. And then, you know, I haven't really even talked about the payroll piece and the payroll taxes that home care companies, agencies pay, where independent contractors, if they don't pay their fair share, and they're supposed to get a 1099 from the person that is engaging them, if that independent contractor doesn't pay their taxes, the liability will come back to the person that was engaging them. And we have precedented cases, one in Chicago, where a family engaged someone for 7 years and the person passed, and that caregiver went to collect unemployment insurance and discovered that they weren't qualified for unemployment insurance because there was no payroll taxes that were being paid and unemployment wasn't being withheld. So real important to know that. So the workers' comp and the payroll piece is really, really important. With a home care agency, you get that.
And Bob, I want to throw in too, you know, some of it is, I understand from the family's point of view how sometimes it's easier, you feel more comfortable with your friend's granddaughter coming over or somebody from your religious congregation that might come in, and you may not know them well, but you know how you know them, so you feel more comfortable with that. What we find though is that those personal relationships really blur the line between how care is provided sometimes and what's really needed. Do you feel comfortable talking to your friend's granddaughter about not showing up on time, about how important it was that you needed to get to this doctor's appointment, as opposed to using agencies where they're an employer based? There is some things we can do on the employer end as far as disciplinary action and finding a replacement quickly and getting somebody over there to get you to your doctor's appointment when you go through an agency as opposed to an independent contractor or a friend, an informal caregiver.
And it's that accountability piece too. I mean,
Absolutely.
You're right. That those lines are blurred, for sure. No, thank you, Michelle, for sharing that. And, you know, I'm not going to read all the rest of them. It's pretty self-explanatory. I mean, you know, a home care agency does everything they can to protect the client and their family that they're serving. And they do that by having all the insurances, they do the background checks, they training and educating, they are doing the care managing and making sure that that caregiver is there at the right time with the right skill sets to care for that person. And if there's a call off, they will back that up, and it's their responsibility to have that. You know, the customization, we're flexible to the client's needs, and then the quality assurance. We're constantly giving, and it's across the board, all home care agencies are constantly monitoring the client's condition, and they're giving the families their updates. So affordability. So as I shared with the independent contractors versus in-home care agencies, you know, they're not all created the same. But when you look at the affordability, you know, look, first and foremost, the agency is the employer. And when you have a independent contractor, you are the employer. The hourly rate, yes, there is disparity. There's no doubt about it. In this example, and again, I have it underneath with an asterisk, quotes, rates are for illustrative purposes, but actual rates vary by provider. But we're looking at about $28 versus 20. But here's the payroll taxes, you know, it's included in the rate, workers' comp's included in the rate, an independent contractor, you have to pay. Agency fee, there is none. With an independent contractor, most are about $25. I've seen them as high as 30 per shift. So if you're using someone for just 4 hours, you're paying per shift, or 8 or 12 hours, that's what you're paying. But in this example, when you look at a 5 or 8 hour shift, there really isn't that much of a disparity because of the insurances that you get. The fact that you have a reputable company that has all the safeguards in place with an employer-based agency. Because of this pandemic, the other thing that you get with an employer-based agency, and I will tell you, I talk to so many of them here in our community and other communities. Michelle laughs at me because I call them my frenemies, and they really truly are. We compete for cases, but we are friends and we work very closely together. We're supplying PPE, and we're also supplying infectious disease control. And I can almost assure you with independent contractors, because that's who they are, they're not doing that. So real important to know the differences. This is under affordability. So I shared pay sources, private pay, long-term care insurance, their VA benefits. And if you are a veteran and you want to learn how to access VA benefits, I urge you to talk to Emily and her firm. She can tell you how to do that, as well as with Medicaid. If you or a loved one, you know, it feels that you have an opportunity to access Medicaid, Emily and her firm can help you along with that.
So may I ask a question, Bob?
Sure.
So going back to the independent contractor versus the employee, I certainly understand the family member or the friend, you know, coming in to help. And sometimes that seems like a good plan at the beginning and turns out not to be such a good plan because that person has other responsibilities, or it's just too hard to be a friend and also the one who has to shower somebody and make sure they take their medications and all of those other things.
Mm-hmm.
Are there, for the folks out there, when they're interviewing agencies, are there some agencies where they work on an independent contractor model and some agencies that work on an employer model? Or if they go with an agency, they know for sure that they can check all the boxes, that taxes will be paid and there'll be insurance and background checks and those things?
You know, that's a great question. I actually do have a slide under advocacy because we did pass a law back in 2015 for disclosure. But you're absolutely right. There are entities that engage independent contractors, and I have listed on this slide registry. You know, and that's part of the reason why, Emily, I wanted to share that all home care is not the same. And there are some entities out there, I won't mention names, that position and present themselves looking like an agency, but at the end of the day, you're not hiring an employee, you're hiring a contractor. So through this disclosure law, which I'll talk about in a second, Senate Bill 1401, every agency is supposed to disclose whether or not they have employees or contractors. So it's really, really important. So it may look like an agency, it may smell like an agency, Yeah, it may taste like an agency, but it may not be an agency. So it's really important to ask if these people are employees.
Yeah,
So
and
thank
that's
you.
why I asked, so people know kind of questions that they should ask. You're putting a stranger in your house, and I think that's very scary for a lot of people. So making sure they have an actual company to go back to who's going to stand behind that person is obviously super important because, as I said, you're putting a stranger in with the person you care about most in your life and hoping for the best.
Right.
In the chat box, I put a link to 10 questions to ask an agency when you're talking to anybody and looking for help.
Yeah,
So questions that you can ask any agency that you're calling, and this will give you these answers. Are your employees bonded and insured? And are you paying the taxes and all of that?
And
so Michelle, if you could do me a favor, because it looks like you sent that to us as the panelists, if you could resend that to include the attendees, that would be fantastic.
Absolutely.
Thanks.
And just so you know, when you get out to that page, one of the nice things that we do at Cypress is we have a resource page that is intended to be out there for the community. And it's not just the 10 questions, but there are a lot of great resources that anyone can tap into and never even engage our services, but it's kind of our way of sharing with our community. So this is a great piece. Thank you, Michelle, for sharing that about the 10 questions. So Genworth, Genworth has a great cost of care calculator. And I encourage each and every one of you that is considering any type of long-term care to go to their site. Just Google Genworth cost of care. I've used this for over 10 years, and I can't begin to tell you how they've improved this and continue to improve it. I will tell you that it's not perfect. I mean, to give you an idea, the hourly rate that they're saying on average it is here in Phoenix is, I think, 26 and a half, and the hourly rate is closer to $28, $29. The community assisted living rate is just a little lower than it truly is, maybe here in Scottsdale, but it's great guidance. And the piece that I really like, because it really speaks to the work that HomeCare is this one here at the bottom left. So if you have a family member that you are considering to have care, and even though they use $26.50 as the hourly rate, it's still a great guidance to see what that would maybe cost you on a weekly, monthly, or annual basis. I've clicked on the tab that shows annual, but you can see this by week or by day or by month. But the cool thing is that this little box here next to calculate, I have in there 44, but you could put 80 hours, you could put 12 hours, so you can get a gauge, and then it will put into this first square box here, it'll put what that cost is on a weekly, monthly, or annualized basis. So great resource. Please use this Genworth calculator. It is awesome. So I'm going to talk a little bit about advocacy right now, and I'll talk a little bit about what you were sharing before, Emily, about the differences really between a contractor and working with an employer-based agency. I'll talk a little bit about the law that got passed back in April of 2015. So these are ripped from the headlines. I won't go through them all, but you can see some of the stuff that has happened to really good people. One that just blows me away is that last year we had a cardiologist here in Scottsdale, a retired cardiologist, that got exploited for $1.2 million by two privately hired caregivers. You'll see at the end some of the community work I do. I'm on the task force against senior abuse with the Attorney General's office. We meet quarterly and we talk a lot about this. This is the stuff I've gotten from them. But as you can see, exploitation is something that is happening every day. I think there is probably far more than is being reported. And I can tell you firsthand, when I first started in the business, there was a woman that was with another agency that she had $10,000 stolen from her. And the other agency had tried to encourage her to file a police report, asked me to have her file a police report, and she would not have it. She didn't want to get involved. She did not want to have a situation where there might be retribution. So there's so much of this stuff going on out there that is not being reported. So I'm sharing with you the stuff that has been reported. and is quite scary. So that Senate bill I was talking about, this is kind of an eye chart, but you'll have access to this through Emily's office. But Senate Bill 1401 passed in April of 2015. It's a disclosure rule for home care companies. I led this initiative with 2 other home care companies. I've been down at the legislature since 2007 trying to safeguard and protect our elderly. It's something that I'm really passionate about, and I think I owe it and we owe it to one of the greatest generations of the world that we're caring for. So essentially, real quickly, a business entity that provides home care in this state needs to disclose the following. 1, whether criminal background checks have been performed on the employees or contractors who provide home care services, the name and position of the person who is responsible to the day-to-day management of the employees and/or contractors, a description of any required training for employees or contractors who provide home care, a description of the home care services the entity provides and the cost of each service, and lastly, a description of the entity's home care service agreements and how an agreement may be terminated. Look, it's not perfect. When we passed this back 5 years ago, we were an extremely red state. Maybe things have changed a little bit. I'm not a real pro-regulation person, but I feel that we have this responsibility to this generation to protect them. So it's progress. It's not perfect. But if you or anyone you know is engaging a home care agency and they're not disclosing this upon engagement, you need to be asking yourself, is this somebody I want to engage? So this was a law that was passed just 5 years ago. Another thing regarding advocacy is the companion exemption rule. This was a rule that was put in place back in 1974, and it was put in place to help those families that had or were providing care for children as well as the elderly, that they would be exempt from overtime. In 2013, the companion exemption rule was repealed. We fought to keep it in place because we knew how expensive care is for family members. I just shared that with you on the previous slides. It went to the Supreme Court twice. It got struck down, so we lost. But the Government Accountability Office, the GAO, reported that the Department of Labor's home care rule, this came out on October 19th. They found out that caregivers didn't earn more money after the rule went into effect. Access to home care actually became more difficult. So the entire goal of the regulatory change has completely backfired. So I can assure you, we're going to try an attempt to do this again. It is not that we don't care for the workers. Many of these workers choose to work those extra hours and not get paid so that they can care for these folks that need that extra assistance. And then lastly, as far as advocacy, I do a little bit of Medicaid work, not a lot. We do it with family caregivers. And I will tell you the minimum wage increases that started in 2017, the reimbursement rates have not been commensurate with that. We had 2 home care agencies go out of business as a result of this. So, I'm part of the Elderly and Physically Disabled Provider Alliance. We've been working really closely with lawmakers in the governor's office and Access. Access is our Medicaid body. We're seeing that we can get this thing corrected. I know with the minimum wage increase, we're going to see a little bit of a pop, but we're still drastically behind. Lastly, we created under advocacy a Safe Home Care Coalition. I'm proud to be a part of a group that was founded by the following agencies below. Questions to ask prospective home care providers. This kind of goes along with the link that Michelle just shared. How do you recruit your caregivers? Should a scheduling conflict occur? Are there trained backup caregivers? Are your caregivers bonded and insured? Are caregivers employees of the agency? Who handles payroll and required taxes for the caregivers? And then what type of background checks? We have been working more along the lines to educate. That's really our main mission. We provide a list of the Home Care Association of America home care agencies here in the marketplace. I'm on the national board of directors. Every one of those home care agencies has been vetted out. Our goal in education is educating the professionals in the acute, which is the hospital setting, and post-acute, which is the rehab and nursing homes, and skilled nursing facilities. And I will tell you, it's an ongoing thing that we continue to do. As I shared with you, it's hard to believe that many of these medical professionals aren't aware of the difference between home care and home health care, but more importantly, the difference between home care and an independent contractor. So we spent a lot of time doing that. So we see a future where we'll be in a world where home is the center of care. I mean, a lot of you have heard about hospitals at home. I think there was a lot of good things that came out of COVID. We could talk about the bad, but the good is, you know, we've accelerated the whole telemedicine thing. We're trying to find more ways to deliver care in the home because communal living is the biggest challenge that many older adults are really faced with. And, you know, we really want to be able to figure out how people, when we know 92% of people 65 and older want to stay at home, how do we do this? So real quickly about Cypress Home Care, you know, I wanted to give you a little bit of information about who we are. That woman in the picture to the right, that's my mom. I was a caregiver back in January 1st, actually it was January 2nd, 1985. My mom was 48 years old and I was 22 years old. My mother had a major heart attack and really was never quite the same. But I found myself in a caregiver role for nearly 18 years along with my brothers. And, you know, that was a real challenge for us. Mom and dad moved out from Baltimore, Maryland, where we're from. They moved here in 1987. And my brothers and I moved here in 1994, 1995 to be close to her. We started Cypress in 1994. And the goal was to really provide respite for family members. And again, if you remember my second slide, it was National Family Caregiving Month. Those unsung heroes. Some of you may be on this webinar here today. You're a family caregiver. You may not have self-identified yourself as one, but if you're doing grocery shopping, you're going to the pharmacy, you're, you know, bringing in meals, you're a caregiver. And, you know, I was a caregiver for my mom. We set up this company to be respite for those family members. Little did we know that in Phoenix, Arizona, Maricopa County, that, you know, there wasn't that nuclear family that I was talking about early on. It was very fractured. And part of that is because of that 280 miles, the adult child is away. You know, you talk about the fact that we have the advent of technology and travel. And a lot of people aren't really from this area. A lot of people chose this area to live because they looked for a better life. They liked the climate. They liked living in this city for a number of different reasons. So I don't have to read all of these. I just want to say that we partnered with a group called Honor in 2019 to provide world-class caregiving, and they have world-class operations. But if you remember the slides early on about workforce, they are a workforce company and they do it really, really well. So we have over 100 years experience in our local care service coordination team. And to date, we've served over 10,000 clients. This is a little bit of information about Honor. Honor is powered by technology. You know, the Paraprofessional Healthcare Institute is an institute that we subscribe to in the labor market for home care. They've been around for almost 40 years. They anticipate between 2020 and 2026 there to be a 1.8 million direct care workforce shortfall. Again, I bring up before the demand is outstripping the supply. And Honor has done a phenomenal job on the recruitment, retention, and training of caregivers, and it's been a great partnership for us. COVID-19 has forever changed elder care. So how are we going to care for our aging loved ones now and into the future? At Honor and Cypress, we use pre-visit check-ins and post-visit check-ins. We like to say that we're ready, trained, and equipped with PPE. I shared this with you earlier. That's the difference between an independent contractor and us. And it's not just Cypress, it's all employer-based agencies. Employer-based agencies have infectious disease control protocols in place, have access to PPE, We do a little bit different only in the sense that we're constantly surveying our caregivers. I'm not going to read through each one of these post and pre checklists that we go through, but before going in and going out, we're constantly checking on the condition, not only of our caregivers, but also the clients that we're serving. And this is a little bit more information about the guaranteed PPE and real-time training. Some more about safety and care and infectious mitigation safety checklists that we go through. And I do want to share, we were built on one, and I talk about this a lot. We have 4 pillars to how we were created. One is providing quality and caring and compassionate caregivers and respite for family members. That's our one pillar. The other pillar is serving as trainers and educators in our community. And I am proud to co-present here today. And I've been doing a lot of the talking, but she's intermittently, provided some insight and sharing with the listeners here today. But Michelle is one of those folks. Lori Fox and Katie Cruz, who runs a memory cafe. The 3 of them are out there in the community. So we're constantly training. We used to have a training lab, and we trained over 1,000 families on how to provide care. We also, one of our pillars is sharing knowledge on dementia and aging. We feel we are dementia and aging specialists. We have a dedicated program for clients and family caregivers. And then lastly, we love being that solution, that solution resource for families. A lot of times when they call, after really peeling back the onion and talking to them, we realize they don't necessarily really need home care. They were needing something else, and we can make a thoughtful referral for them. We've received a lot of community recognition, and for me, it's validation for the work that we do. And then, I talked about community involvement. This is just a smattering of some of the things that I am involved in. It doesn't even cover the stuff that Michelle's involved in, or Katie's involved in, some of the other members that are involved in. But, both locally as well as nationally, we feel like we need to have a seat at the table. That old adage that if you don't have a seat at the table, you might find yourself on the menu is really true and real. We advocate for the clients that we serve, and we want to be there to help do that. And Michelle, before we take any questions, you have anything else you would like to add?
I think that the social worker in me always comes out when we talk to folks. If you're questioning if it's time for home care, the answer is yes. So if that question's ever crossed your mind, yes, it's time. And any of the home care agencies out there that are like Cypress that we know very well can work with you on how to approach it with your loved one if they're saying that they're not ready, or they don't want somebody in the home, or they're not comfortable with it right now. Because this is what we do every day. And it's the first time for many families going through it, and we recognize that. And so there are ways to talk about care. It's not blaming the person saying you have to have care. It's how do we make everything work well again? How do we make sure you can stay home as long as you want to stay home? Because like you said, Bob, that's everybody's goal. Nobody ever decides, hey, I think I'm going to move into assisted living and this is where I want to go necessarily. There are great independent living communities in Phoenix, right? And that's one of the great things with home care is that we can provide care in any of these settings. You can be living in the same home that you've lived in for 50 years. You can be in a senior living community where it's a 55 and over. You can be in assisted living. You can be in memory care. We can provide help in any of those locations. But the type of help and how we approach that help really is individualized. And so we can work with you, any of the agencies can work with you on how to approach it with your loved one, where to start with the level of care. Maybe we're not comfortable with showers immediately, but we're open to assistance with getting to appointments, or somebody running errands, or somebody coming in and even helping with things around the household. And we can work up to other things once we form a relationship. That's a social worker. I'm always about the relationships and how can we help you and where do we start? And
well, I always say that every client that we serve is like a snowflake. They're all very unique. And
yes.
Michelle, you've been extraordinary in helping family members be able to be open up to care. So a lot of times we're talking to the adult child, which could be a daughter or son, and saying, you know, mom's really resistant. She's not going to like care in the home, but I know she needs care. I was home during Easter. I was home during the summer and noticed that, you know, she is, you know, not doing a really good job with personal hygiene and the home is not as a wreck. You know, how do I get someone in when she's resistant? And, you know, there are lots of ways to do it. And, you know, I've heard you coach families saying, you know what, just say I'm a friend. You know, I want to bring a friend in. And, you know, you have to get creative. There isn't one solution that fits all, right?
Right, absolutely. And so any of the agencies out there, you know, that are these employer-based that have been around, that Safe Home Care Coalition had a list of them at the bottom there. We're really good at this. We can help you with this. You know, sometimes it's not about if the person needs help, but it's about if you as the family member needs the help. And so what can we provide for that person so that you as the family caregiver is getting what you need?
And that goes back to the respite, right?
It goes back to the
recharging the batteries, yeah.
And it goes back to being willing to accept help and ask for help. And, you know, we work with families and work with Emily because a lot of families will come and say, well, I'm worried if I spend all the money now and if I need help in the future, there's going to be nothing left. Well, do they qualify for All-Tex at this point in time? Are there veterans benefits that they might qualify for? That shouldn't keep you from talking to somebody about the potential for care and what can really be provided. The other thing is that, you know, we provide some really great family support pieces. And I think it's important to recognize that sometimes, like you said, the care isn't about in-home care. It's about how do we support you as a family caregiver. And so we work with a lot of local agencies. We help facilitate support groups with other agencies. And we can help you get connected to the resources that will support you as a family caregiver in the way that you might need.
And just to expand on the benefits, if you're looking to access veterans benefits, your Medicaid benefits, that's something that Emily and her firm can help you out with. She can paint that roadmap and what that might look like. Michelle, thank you for chiming in. I know we just have a couple minutes, Emily. Is there any questions on the board? Anything you would like us to address? I can't thank you enough for the opportunity to be here today to really talk about in-home care and how people can, you know, be able to age successfully in place and really identify a lot of the obstacles that we're all dealing with. The big one being COVID, but a lot of the other ones that I did share with.
Yeah, we don't have any questions. I'm so pleased that of our participants in staying and listening to this fantastic information. I think there are a lot of myths out there, and so getting facts to people, there's no better way to do that than to tell them and have that information available. It's great to know the resources that you could provide even if somebody's not quite ready to engage your services so that they can give you a call and have some conversations about community resources that are out there to help. So I want to thank both of you so much from Cypress Home Care for taking some time out of your busy day to educate people about what goes on. So we look forward to the opportunity to serve you and to answer any questions that you have at some future time. And we wish everybody a very safe and healthy season out there. And thank you again so much for joining. It always feels weird when I end a webinar because, you know, when you're live, you have the opportunity to shake hands and answer some final questions. And, you know, it doesn't seem quite so intimidating. But on here, we just end it. We leave the meeting. And so thank you all so much. Take care of yourselves and stay safe.
Thank you. Thank you, guys.
Thank you, Emily. Thank you, everybody.
Be safe.